Hi, my name is Eva Hernandez, and I'm here to do patient education on prenatal education precaution skills video. I'm on my nightingale uniform. I have my whole uniform on and appropriate shoes. I have my badge that's visible. I check my doctor's orders. Confirmed my patient's to identify patient's name and date of birth, and I washed my hands before entering the room, and I walked into the room, closed the door for privacy to give my patient privacy. And good morning, Mrs. Smith. My name is Eva, and I will be doing some patient teaching on some precautions during your pregnancy, and letting you know what things that you should be aware of. First of all, foods to avoid would be any type of meat that is uncooked, because, for example, fish or any raw or uncooked meats, seafood or chicken, because it contains a bacteria of salmonella or a parasite that causes serious illnesses. The other one would be unpasteurized milk or any cheese, because it carries listeria that can lead to miscarriages, miscarriages or severe infections to the baby. The other one would be high mercury, like for instance high mercury in some type of fish like shark, because this can cause harm to the baby and the developing of the brain and the nervous system. And also stay away from uncooked raw eggs, because this can cause also a risk for salmonella. Now, deli meats and hot dogs, as long as it's cooked, it's okay to consume. Because they also carry bacteria, so it's very important for them to be fully cooked. Over-the-counter medications that are okay during pregnancies to consume and are unsafe, and other medications can be harmful, but the medications that are safe would be acetaminophen, which is Tylenol, and that's usually used for pain or headache, and that is okay, no harm to the baby. Prenatal vitamins is also okay to consume, especially your prenatal vitamins and your phenolic acids, and usually it's recommended to take 400 to 600 micrograms of phenolic acid and iron. And the other one would be calcium and iron supplements, and it helps support the bone development, and to prevent anemia. The other one that is antacids, which is calcium based, and this is good, okay to take, because for heartburn during your pregnancy. Medications and supplements to avoid would be Motrin, which is ibuprofen, because Motrin, aspirin, naproxen, because this can affect the baby's heart and kidneys during the late pregnancy like around 36 weeks. Cold and flu medications, because it consists of multiple ingredients, which contains decongestant, and those can reduce the flow to the placenta. The other thing is herbal supplements, because they are not regulated, and also they can also affect the hormones in the fetal development. And if you are taking any herbal supplements, please let me know, or let your OB doctor know, because this can affect contraindicate with some of the medications, if any medications that you may be on. Avoid high doses of vitamin A, because this can cause birth defects. Environmental exposures and hazards that will affect fetal development would be tobacco smoke, because it increases the risk for low birth weight and preterm birth. The other would be pesticides and chemical cleaners, something that you may find in your home. They may interfere with the fetal development and increase risk for birth defects. Lead exposure would be paint that you would have probably in your garage, old paint, because the water that sits above the old paint is water that's contaminated, and this can cause developmental delays and learning disabilities. The other one would be cat litter box. Any boxes, if you do have a cat, or because the litter contains toxoplasmosis, which is a parasitic that the baby can affect the baby and cause a parasitic infection. The other alcohol, tobacco, and substance use. For example, alcohol. There's really not an amount during pregnancy that is safe, but the alcohol can cross the placenta and cause fetal abnormalities. For example, spectrum disorders, or which can lead to learning disabilities, and also with growth problems, and which sounds horrible, facial abnormalities too. Illicit drugs and non-prescribed medications, for instance, cocaine, marijuana, any opiates, which would be a non-prescription, methamphetamines can cause preterm labor, low birth weight, baby can have withdrawal symptoms, that can cause sudden infant, SIDS, and then the and also the doing those non-prescribed drugs or medications also can cause long-term development issues. The travel precautions that you should take into consideration during pregnancy would be: the safest is to travel during your second trimester, whenever your nausea and vomiting has subsided, because there's less of a risk for any complications. To prepare for your travel is to carry your full file regarding your prenatal care, and also wear comfortable clothes, and also, most importantly, keep hydrated and eat regularly during your travel, whether you're traveling via car or airplane. If you're traveling via airplane, pack some snacks, because so you just in case you do get hungry. Travel considerations and risks: try to avoid not traveling to countries or places where there's an outbreak of infectious diseases like Zika. Avoid traveling, like I said, avoid traveling to those areas that have the infectious disease or limited access to medical care, which is very important. It is not recommended to travel. It is not recommended for you to travel if you have a high risk pregnancy, or if you have complications, placental complication, or if you had preterm labor, or you're advanced in your pregnancy, like 36 weeks. It is not recommended for you to travel, whether it's via airplane or via car. Dental care during your pregnancy, it's best to seek dental care after your second trimester, because by then your dental, it is okay to get dental cleanings after your second trimester. Also too, because by then your nausea and vomiting would have probably already subsided, and you can obtain any necessary procedures, like your cleaning, your basic procedures. Common dental issues that you may have would be inflammation of the gums, due to inflammation of the gums and bleeding of the gums due to hormonal changes. And also there's increased risks for gingivitis, or for cavities due to the nausea and the vomiting, and the dietary changes. Regarding, if you had, back to the gingivitis, if you do or had pre-pregnancy, before you got pregnant, dealing with gingivitis, it can get worse if it's not treated. The most important thing overall, this information that I just went over, is to maintain a healthy, good oral health during your pregnancy, and because it would support both you and your baby's baby. And also overall, just knowing of all of this precautions to take prior to traveling, or taking any medications, or what foods to avoid. It's important for you and your baby to have a healthy pregnancy, And also, I know this is a lot of information that I just went over, but I will be sending you home with some handouts that has the information that I just covered, so that way you can read at your leisure. And if you have any concerns or questions, you can always reach out and call, either make an appointment with me, or call me directly at the clinic, and I will answer any concerns that you may have. So, do you have any questions, Mrs. Smith? Okay. Alrighty then. That's fine. You're gonna go home and review the information, and then if you have questions, you will reach out to me. That's fine too. Okay. Well, thank you so much for coming in today, and I look forward to hearing you and seeing you at your next appointment. Thank you. Oh,